Some women are reporting that their periods are being affected by COVID-19 vaccines, but one expert says it's too soon to say if the shot is affecting menstrual patterns.
Whenever two things happen together, we tend to think they're related somehow.
Dr. Geraldine Pryor at the Center for Menstrual Cycle and Ovulation Research received a letter from one menopausal woman.
She hadn't had her period for 2 years, about 2 years after her last period, and she was 53.
This woman got her shot on April 12th, and then on April 18th, she says she started spotting, and she was convinced this was caused by the vaccine.
And I told her that it could be quite normal if she noticed a few things before the flow started, because about 10% of women have another period after a year following their last flow. So if she noticed sore breasts or bloating, fluid retention, increased cervical mucus or PMS type mood things, then it's very likely that that's a normal period.
Other irregular periods Dr. Pryor has heard about primarily involve near-menopausal women or teenaged girls. She says it's too early to make a connection between their periods and COVID vaccines because of a lack of scientific data, but she says the reports are increasing.
So I think cycles are being disturbed because of all the changes that are coming, because in general we're isolated, our pattern of work, our pattern of play, our pattern of visitation with family and friends is disrupted.
Just the stress of these situations can interfere with our ovarian cycles.
UBC psychology professor Lisa Galea surveyed women and postmenopausal women about disruptions to their periods or postmenopausal status during the pandemic.
And I'll say that about 30% of people indicated they had disruptions to their menstrual cycle. This is not because of the vaccine, because the vaccines hadn't been introduced yet. And 7% of postmenopausal women said they had increased bleeding and spotting of that, things of that nature.
Dr. Pryor says the changes that women observe are real and wants them to feel assured about getting vaccinated.
Even though I intend to be reassuring about vaccines and menstrual cycles, that doesn't mean I'm discarding this data. It means we don't have adequate data yet to know what's going on.
In Vancouver, Kier Junos, City News.